I started Clinic Esperanza about 21 years ago, and it started on my kitchen table, and it has grown into a clinic where we see over 100 patients daily now. It's an outpatient clinic with a birthing center. We have general medicine outpatient, acute and chronic care, and pediatrics, OBGYN, dentistry, community health. We teach prenatal classes, and we have a diabetic club at the clinic. No one's ever turned away because of lack of money, but we do charge a nominal fee of about $12. If they can't pay, nothing's ever said, but with that $12, they also give us, or we also give to them their medications. We can do EKGs and ultrasounds in the clinic also. We see about 100 patients a day, and on average we have about 5 prescriptions per patient, so that's about 500 prescriptions that our pharmacist fills. Our main medical problems that we see are, for the adults, are diabetes, hypertension, gastritis, some accidents, and for children it's upper respiratory problems and asthma problems. So we have a program that's called International Medicine and Spanish Immersion Elective, and that's offered for anyone that will get course credit for it, or if they'll be able to use it for, on their CV, or, to get into a medical program. I feel that we have a good exchange between our Honduran doctors and our doctors and residents that come down from the States, in that our doctors know the culture, they know how to get things done in the country, they know the local diseases and what medications are used for different things. I would hope to partner that with the doctors that are coming down from the US or Canada or wherever they come from, to be able to share the knowledge of how they've learned how to do things in their university programs. It's not one way's better than another, it's just there's different ways to do different things, and they pretty much achieve the same goal. My hope is for when we do have the students or the residents come down, that they develop a lifelong friendship with the Honduran doctors, and that there can be a continual friendship there as well. It would be awful for somebody to have to come down and live on a tropical island and have the opportunity to learn to dive the best tropical reef, in my estimation, in the world, because our reef is right at the edge of our island, whereas it's always been touted that the Great Barrier Reef is the best reef, but it's like an hour off the coast of Australia. So, and the weather here is about the same all year round, with a beautiful tropical breeze. I don't know if you can see the breeze in the background blowing the trees, but we generally have that year round. Our top need right now is for a long-term provider to come down. We're even looking at possibly getting 2 providers that would share the experience, so that when one was on vacation or had to go back to the States, the other one would be here. It's not necessarily to see patients, but more to mentor the residents and our newly graduated Honduran doctors. We did have one doctor that was coming down pretty regularly, and what he did was would always bring in 3 board questions, and the doctors that were here, they would get together for 15 or 20 minutes and go over the questions, why their answer was correct or why it wasn't, and the students, or excuse me, our doctors really loved doing that. They learned a lot having the doctors come down. And our doctors don't have the benefit of each of them having the textbooks that they need. They generally share a textbook, a medical textbook, between 4 to 5 doctors while they're in med school. So they sometimes only get the highlights of those, and they're sponges to learn from the American doctors that come down and work with them. So if you are interested, you can go on our website, which is clinicesperanza.org, or you can contact me. My email is peggy@clinicesperanza.org, or on our website we actually have a tab that is for volunteers, and you can read pretty much what's involved with volunteering at the clinic and what you need to do to come see us. We'd love to have you.